Hello there, Mr. Heap. Are you all right?
Yes, thank you.
Okay, so you called up earlier saying that you'd had some problems with your hearing. Just want to explain a little bit more about that.
Yeah, I woke up this morning. My wife was talking to me and I'd got my left ear facing her. I couldn't hear her at all. When I turned around my right and I got my right ear facing her, I could hear her very well.
So it's the left ear only.
Yeah.
So did this problem start this morning?
Yes.
Right, and what time about was that?
Well, I noticed it when my wife woke up. I woke up about 5 o'clock and I don't recall hearing anything out of my left ear from then.
So it's the same now as it was when you was lying down in the bed?
Yeah.
Right. And it's not changed?
No.
Is there any pain associated with the hearing loss?
No, not at all.
Right. Any discharge?
No. I did check to see if it was wax. I used a cotton bud and there was nothing on the cotton bud at all.
Right, so you need to be careful with that because you can obviously push wax further against the eardrum and you can develop these little plugs inside the ear,
Right.
which need a little bit more work, but we'll have a look. Is there any pain in your jaw when you're talking or chewing?
No.
No jaw pain. Okay. Are you under the weather at the moment, would you say?
No.
Right. No viruses?
No.
Coughs, colds?
No.
No recent bacterial infections or anything like that?
Well, I had COVID and I had the flu in December, but that's a couple of months ago now.
Would you say you've made a full recovery?
I think I have, yeah.
Right. And your hearing was unaffected during that period?
No, it wasn't affected.
Wasn't affected, okay. At the moment, any dizzy spells?
No.
Any ringing in the ears at all?
No. I do occasionally get tinnitus, but it's very rare. It never seems to last long.
Okay. How long would you say you've suffered with tinnitus then?
For a good many years.
And it's just rarely that you get an episode of tinnitus?
Yeah.
How long does it seem to last for, the ringing?
Probably about an hour at the most.
An hour, okay. Are you taking any medication at the moment?
Only for my diabetes.
Right. Metformin?
Yeah.
Okay. What dose?
I take 4 tablets a day at 300 milligram.
Is there any family history of hearing problems?
Not that I know to.
No, no congenital issues?
No.
Okay. Have you ever visited an audiologist or had your ears checked?
Where I work, there's an audiologist comes in regularly.
Right. But have they checked your ears or not?
No.
No, okay. So I think we can do that. I think we need to come round and inspect both ears. Try and get to the bottom of things, all right.
Okay.
All right. Would you be available in half an hour at all?
Definitely.
Okay, we'll send one of the audiologists round and then we'll get it seen to, all right. So
All right.
we'll see you shortly.
Okay.
All right. Bye now.
Bye-bye.
You okay, Mr. Heap?
Yes, thank you.
Right. Are you still having the same problems in the left ear?
I am.
Loss of hearing. Okay, so I'm going to stand on the right side. Just take the glasses. Okay, just turn that way for me. I'm just going to have a little feel of the ear. I just want you to tell me if you feel any pain or tenderness. Is that okay so far?
Yeah, can't feel anything hardly. Any potatoes growing around there?
Maybe some sprouts. Okay, just going to have a feel of the other ear. Let me know if there's any pain or tenderness.
All right.
Just going to have a look through the ear canal now. All right.
All right.
It's nice and safe. It's not going to hurt. Just come forward a little bit for me if you can. Okay, just turn this way. All right, just tilt to the left a little bit. Let's have a look. Okay, just starting with the lateral portion. Through to the medial area. Normal levels of wax, doesn't seem to be any obstructions. Through to the tympanic membrane. Pars flaccida, pars tensa. Pearly white, thank you. Are you okay? Are you okay there?
Yes, thanks.
Okay, so just through to the medial portion there. It looks as though there's an obstruction in your left ear.
Right.
I think from the time cotton bud in your ears, it's pushed the wax and dead skin together and it's formed a plug. So
Right.
it's like a blockage essentially against the membrane. And I think that's what's led to the loss of hearing. I can't see anything other than this. But obviously, once we've removed the plug, we're going to have a look at the tympanic membrane just to make sure there's no issues. But obviously, we need to deal with the plug.
All right.
That could be, the reason why
Okay.
you're suffering. All right. Just come forward a little bit more. Let me just confirm with some hearing checks. Just going to ring the tuning fork.
Okay.
Tell me whether you hear it more on the right or the left, or whether you hear it not at all in the left, all right?
I can hear it in the right. I can't hear anything in the left.
Not at all in the left, all right. Just
Yeah, I can hear it just in the right.
okay. Now I'm going to place it behind the ear there.
Okay.
Tell me when you stop hearing the ringing.
All right. Now.
Can you hear it there?
Yeah. Can't hear anything there.
Can you hear it there?
I can sort of feel it, I can't hear it.
Okay, so you can just feel the vibrations.
Yes.
All right. Okay, that's fine. So what I'm going to do is I'm going to get you booked into the clinic and we're going to do some microsuction
Okay.
in the left to remove the plug.
All right.
And then we're going to review the membrane just behind it and just see what's going on.
All right.
All right, so I'll see you tomorrow at 9 o'clock if you can.
No problem.
All right, thank you.
All right.
Bye now.
Thank you.